Now, now we're trying to look at the next type of amputation under our orthopedic classes, and this is what is known as the above elbow amputation. So above the elbow amputation, you can also call it the transhumeral amputation. So above the elbow, okay, which part of your body is elbow? Of course it's this. So everybody, let me get my pen. Everybody should know what the elbow is. Okay, so above the elbow could be here, could be here, could be here, anything above. So you are losing the elbow joint, which will affect you a lot. Okay, so an above elbow amputation, also known as transhumeral amputation, is another picture. Should help you guys more. So this, you have a prosthetic, so it's a surgical removal of the arm, and it's done above the elbow joint through the humerus with the upper arm bone. So it's a major procedure. It's usually performed when the limb cannot be saved. A lot of things will make it that the limb will not be saved. Do you understand? So you just have to cut it so that it will prevent it causing more damage to you. So what are these several things? Sometimes it's severe trauma, like crush injuries, accidents, war-related injuries. I remember a woman was recently done this surgery in our hospital, and she had this cut from a bandit attack on her farm. The cut her, so they just had to like cut out the arm. So it could be cancer. So cancer, and you are scared that the cancer might spread up to the arm and to the rest of the body. Infections too. So osteomyelitis there. And also vascular disease like poor blood supply can also be an issue, leading to tissue death. So also congenital issue, rarely though. Okay, so surgical procedures is just like I told you guys. Above the elbow is not a definitive position, so the surgeons have to decide the exact place where they will actually make the cuts, So determined by the extent of damage or disease, determined by the extent of damage or disease in the arm. So you remove the disease or damaged tissue, you preserve the healthy parts. They can shape the residual limb for prosthetic fitting. So they allow you to heal. So it's after you heal, they now bring these prosthetics. Okay. So closure with careful attention to nerve endings, because you don't want nerves compressed. You know what happens when there's a nerve compression? Pain and numbness. Okay. So that's what we have. Then rehabilitation, where you put prosthetics. So we have the modern transhumeral prostheses, which may be mechanical or myoelectric, controlled by muscle signal. Then we also have physical therapy. We are trying to focus on strengthening range of motion and train the person on how to use the prosthetics. The occupational therapy, this is where you now help the person adapt to their daily activity, and also if they do work, how to be able to use this prosthetic and be able to do the work. The psychological support, where you talk the person through the situation and help them, adapt back.